Well, thanks, Stace, for the kind words, and thank you to you and your whole team for really being the driving force for this conference. This is a phenomenal opportunity for us to engage and really bring people throughout the country to talk about ways to really make the healthcare system better. For those that don't know Stace, she is a tremendous driving force within the agency to ensure the voice of the customer, the voice of the healthcare provider really comes forefront to all decisions that we make throughout the agency. During the past 3.5 years or so, I had the privilege to travel throughout the country to see healthcare being delivered firsthand, to really see the challenges that were facing the healthcare system. That was during the COVID pandemic, but also during a time when the healthcare system was recovering. I worked with the team here, and the team really pushed me hard, pushed us hard, not just to visit the top performing providers, top performing health systems throughout the country, but to really see those providers that have challenge, that have faults, that are really struggling to do the right thing, and rather than just visit those hospitals, those health plans that have achieved the highest quality ranks, we chose to visit those that were struggling. There were two-star hospitals, two-star nursing homes, for example, and really ask the question, what is holding you back? I think time and time again, the answer was not bad intent, but it was a team, a staff that was overburdened, that didn't have the resources that it needed to ensure that care was the highest quality. We traveled to areas of the country that have lost jobs. We have traveled to parts of the country that have large safety net provider, and just seeing the impact of what happens when teams, when staffs, when organizations don't have the time, don't have the resources, don't have the staff to do what they want to do best. And so that led us to really have the conclusion that if CMS wants to be a true trusted partner, that if CMS really wants to ensure that we're doing everything we can possible to ensure those that we insure get the best possible care, then we have to do far more and think harder for how we take away burden, for how we think of take away waste, to ensure that we're giving back time, we're giving back resource, we're giving back energy back to the healthcare delivery systems that then will ensure care is better, higher quality, and really designed to best serve those that CMS today covers. Things that CMS wants to do, things like changing payment to ensure that we're paying for caregivers that are treating for ones that have dementia. That requires us to think harder for how we design healthcare systems better. If CMS wants to truly make nursing home care better, higher quality, safer, then we've got to think hard for how we do things differently, how we regulate better, how to regulate smarter, get information better, again, giving back time to those who are trying to do the right thing. If we want to make sure that we take away friction in the healthcare system and take away things that drive people to not get the care they need, then we have to think about processes differently, things like prior authorization to ensure that those decisions are timely and are done consistently. And as Stace talked about, we need to be taking some bigger bets and thinking about creating, for example, one source of truth for all provider directory data to ensure that every health plan, that every hospital system, that every physician office doesn't have to do the same thing 10, 15, 25 different ways. And that's a responsibility that CMS needs to take on. Today's conference is designed to really help us create those new ideas and to really hear from those that are providing care directly, those that are receiving care, to help us find the best answers. And one of the mantras that we have here at CMS is that when we take the time to ask people to join us, that we have an obligation, we have a very strong responsibility to ensure that we're acting upon those good ideas. This is the second conference, and hopefully for those that attended the first conference can see today that your ideas, that your suggestions, that your energy now is part of CMS policymaking. And so that is the goal, that is the intent for us to do today, to carry the same mission forward of getting ideas not from us, but from those who are providing care, receiving care, thinking through how to organize care best, and then bringing that work back to the agency to ensure that we're listening well, but more important, that we're then acting. I want to thank again the thoughtful speakers that have come forward today. We are super excited to hear your thoughts, to hear your ideas. Again, I want to thank the CMS team here that built this conference, came up with the idea, recruited the speakers. I cannot take credit for that, but can have tremendous pride in this conference coming together. And I cannot thank those enough that have joined us today. We are very honored you're here, and we are really excited for the conversation that's going to take place today, but also going forward. With that, we'll stop here, and I'm super excited for the next speaker, Dr. Jonathan Perlin. He is a friend, he is a mentor, he is another driving force for changing healthcare for the better, and I know that we're going to hear some really powerful words from him. So with that, thank you, and I cannot wait to hear today's conference.
Thank you, John. Next, I have the pleasure of also reintroducing our keynote speaker, as Jon Blum mentioned, for today's conference, Dr. Jonathan Perlin, President and CEO of the Joint Commission Enterprise. The Joint Commission Enterprise includes the Joint Commission Resources, Joint Commission International, and the National Quality Forum. We are thrilled to have Dr. Perlin give today's keynote address. CMS and the Joint Commission have a unique opportunity to collaborate to address administrative burdens and structural issues that can contribute to some of the challenges we'll be discussing throughout the day. To quickly introduce Dr. Perlin, before joining the Joint Commission, he served as President, Clinical Operations, and Chief Medical Officer of HCA Healthcare, where he led clinicians, data scientists, and researchers in developing a learning health system model for improving care at the system's 189 hospitals and 2,200 other locations. His team's work achieved national recognition for preventing elective preterm deliveries, reducing maternal mortality, using artificial intelligence to improve sepsis survival, and developing public-private academic partnerships for improving infection prevention and treating COVID-19. Dr. Perlin's CHARGE Consortium partnered with HCA, the Agency for Healthcare Research and Quality, and academia to create a reusable platform for accelerated research using real-world evidence from the care of over 400,000 COVID inpatients. Perennially recognized as one of the most influential leaders in healthcare, Dr. Perlin maintains faculty appointments at Vanderbilt University as a clinical professor of medicine and Virginia Commonwealth University as an adjunct professor of health administration. With that, it is my pleasure to turn it over to Dr. Jonathan Perlin.